Hi, this is Tobe Hanson, Bay Area's sports injury specialist and muscle and joint pain eraser. Do you have a bad shoulder? Have you tried to get some treatment for the shoulder? Have you had the pain for years and it doesn't seem to get better? What have you done for it? You went to the doctor, you were told it's bursitis, it's tendinitis, it's shoulder impingement, etc., etc., etc. Doctors giving you pain medication, maybe they give you a cortisone injection, maybe they send you to physical therapy. You go to physical therapy, you get an exercise program, and you realize that everyone with a shoulder problem have the same exercises. They get the shoulder rehabilitation program. Does this make any sense to you? Are you any better? Is your shoulder better now, or do you continue to have problems with it? Now, if the shoulder gets bad enough, then the doctor's going to tell you you're going to need to have surgery. No one stops to ask why. Why is the shoulder in pain? Why does the pain not go away? Why does it keep coming back? How come that sometimes it hurts more and other days it doesn't hurt as much? We are so conditioned to treat the symptom that we don't question the cause. Your body needs to have what's called a muscular balance around every single joint. That means that the muscles have to be like the instrument in a symphony orchestra. When the shoulder moves into flexion, extension, abduction, adduction, horizontal adduction, horizontal abduction, external rotation, or internal rotation. All the muscles have to work together. Each instrument or muscle have to play the tune at the right time. The muscles need to know when to start to contract and when to start to relax. When you get what's called a muscular imbalance, certain muscles are not contracting or relaxing at the right time, or they keep staying contracted, or they're not able to contract. This is like the symphony orchestra when people are playing at the wrong time, at the wrong key. And of course, it's not going to be a beautiful piece. Music is not going to be beautiful. Depending on how bad it is, it might even be horrendous. So in your body, it's like a car. When you take your car in to have your wheels aligned, there's a reason for doing that. It's going to save the lifetime of your tires. It's also going to help the car from breaking down. When the wheels of the car is not aligned, the car will pull to the left or pull to the right. That causes a friction on the tires, and it causes the tires to wear unevenly. Now, by aligning the car and rotating the tires, you could actually run longer on those tires. But not only that, by aligning the car is able to go faster on a straight line without being pulled to one side and have to compensate for that. In the long run, if the wheels are not aligned, it will not only cause the tires to break down, it will eventually break down other parts of the car. Well, the shoulder joint is one of the joints which have the greatest movement in the body. Because it is a ball and socket joint, here's the left shoulder. This piece here is the shoulder blade. Here is a ball, here's the socket, and here's a ball. As you can see, the socket is very shallow. If the socket would have been very deep, it would have limited the range of motion of the shoulder. What gives the shoulder such great range is because the socket is shallow. However, this creates other problems. That means the shoulder is not as stable. Because the joint has such great range, stability has to be given by both something that's called the labrum, a ligament capsule, and 4 small muscles called the rotator cuff. And outside of them is all the other muscles. Now, when the muscles are pulling unevenly, the shoulder could rotate in, or the shoulder could be pulled forward or back or up. Anyway, the muscles are pulling, the bone will move in the direction the muscle is pulling. So when the muscles are pulling unevenly, it means that the posture change, the spacing in the joint change, and because of the changed posture and the changed spacing, it now affects the ability for the shoulder to move in what's considered normal range. So, the muscles are pulling unevenly, the shoulder's in the wrong position, there's less space in the shoulder. Now, when I move it, there's going to be tissue inside of the shoulder that gets pinched or inflamed or irritated. It could be a rotator cuff muscle that gets pinched underneath the bone here called the acromion and the collarbone. It could be a bursa, a little gel sac that's supposed to prevent friction that could be pinched. It could be the biceps tendon. It could be tendinitis. If the muscles are pulling unevenly for a long period of times, where the muscle attached, spurring, bone spurs could form. Because the muscle is pulling so much in that place, the body tries to strengthen that attachment with calcium and eventually form a bone spur. Nevertheless, the underlying cause of the pain of the shoulder is because the muscles around the shoulder are not in balance. They're not pulling evenly. They're not contracting when they're supposed to contract and relaxing when they're supposed to relax. Some of them are staying tight and some of them are not contracting at all. This imbalance is what causes the ongoing pain in the shoulder. Now, if you get a cortisone shot in there, it's an anti-inflammatory. It takes away the inflammation and the pain. But you walk out of there having no pain, but once the cortisone wear off, if the imbalance is still there, the pain is going to come back. If you take pain pills, ibuprofen, Advil, Tylenol, or whatever brand, or prescription pain medication, it too will take away the inflammation, but you still have the imbalance. The muscles are still pulling unevenly. So you go to physical therapy. You get exercises to strengthen supposedly weak muscles. You get maybe ultrasound, electrical stim, heat packs, cold packs. You've been taught how to stretch your shoulder. All of this is good. The problem is, if the treatment is not specific enough, you will not have great results. So in other words, the key is to find which muscles exactly are tight, contracting, which muscle exactly are not contracting. Then you need to relax the tight muscles, and then you need to find a way to strengthen the weak muscles if needed. Then you also have to figure out, why are those muscles tight? Why do they keep tightening up? In our society, no one questions why. We just treat the symptom. There's cause and effect, action and reaction with everything. If a muscle continues to contract, there's a reason for that. I've spent 35 years developing a manual therapy, which is a fusion between ancient Chinese medicine and modern day sports medicine. In this therapy, I'm able to use similar methods to a physical therapist to evaluate posture and range of motion. I'm doing manual muscle testing or applied kinesiology to test the strength of muscles used by both physical therapists or chiropractors. And then, once I know exactly which muscles are too short and need to be relaxed and which muscles are not relaxed, I use muscle testing or applied kinesiology as a feedback to find where the tension is. And then I release tension in trigger points and acupressure points. Some of those points are local, right in the muscle that is too tight. Some of them are further away. The problem is not always where you feel the pain. And because of the intrinsically of the acupressure system, I could figure out a pattern and why a muscle keeps getting too tight. It could have something to do with exercises you're doing, how you sit, how you sleep. It could have something to do with how you breathe. It could have something to do with how you think, what you believe. It could have something to do with your state of mind, your attitude. It could have something to do with how you eat, if you eat food that is not good for you. It could have something to do with allergies or something that you're reacting to that's causing an inflammatory response in your body, which is causing contraction, tightness in certain muscles. So with this therapy, I'm able to pinpoint exactly where the main tension is. I'm able to release this tension in just minutes. The points where the tension are sore, but the pain releases within 30 seconds to a minute. And so in a 30-minute session, you can literally feel your pain vanish away. You could move your arm that you couldn't move before the treatment. You could go into positions where it used to hurt and it no longer hurt. And when your muscle is being tested, it is now strong. And you could feel all of this immediately. So in 30-minute session, you could feel your pain vanish away. And now you could rest sure that you're treating the cause of the pain. You will also get to know why this muscle is tight and what you could do yourself to prevent this muscle from getting tight again, so that you're not dependent on a medication or a drug or a cortisone shot or constant treatment or physical therapy. This is a method to find the cause, treat the cause, and educate you on what you need to do to change your way so that you could feel better, perform better, and have a better life. Check me out, tobehanson.com. That's Toby with an E and Hanson with an O. Come see me. I love to take a look at your shoulder, get you back in action, get you feel great again, and improve the quality of your life. Thank you.